Why should I spend money at the eye doctor when I have 20/20 vision and I don't have problems seeing anything?
My job offers vision insurance, but I think I'll wait till I feel my vision getting worse.
Well, you ready to get your eye exam?
Ah? Eu não preciso de exame de vista, senhor. Eu vejo melhor que você.
¿Por qué tengo que ver un oculista si puedo ver todo lo necesario?
I hear these questions all the time, not usually from my patients, but the ones who are dropping those patients off, or maybe who are sitting in the lobby or watching the exam kind of as moral support for that person. But usually when I start showing the pictures of the back of the eye or the retinal photos, that person starts to wonder, should I get my eyes checked or not? Because remember, the purpose of an eye exam is not just to get you glasses or to help you see clearer. That's a bonus. What we get to do is make sure the eyes are working properly to give you the best vision so you can get the most out of them. Remember, glasses are only prescribed if absolutely necessary. Just like in your regular health check, your doctor's not going to give you a prescription for high cholesterol if you don't have high cholesterol. You only get it if you absolutely need to. So today in this video, I'm going to explain why getting your eyes checked yearly is an important addition to your yearly routine health checkup. So let's focus on eye exams. Hey everyone, I'm Dr. Shenai from True Focus Eye Care. In today's video, we're going to be talking about eye exams for people with perfect vision. Now, I understand this is not the best video to make. I don't know how many people with perfect vision are searching, should I get an eye exam? Honestly, those with perfect vision who are not worried about their eyes are not the ones that are going to be searching whether or not they should get an eye exam. So if you stumbled into this video and you have a friend or a family member that you think should hear this, then share it to them and maybe we can see if we can get them in to get their eyes checked. Now, not long ago, I made a video about in-person eye exams versus online eye exams and why it's important to get your eyes checked by someone who actually specializes in vision in the eyes, like an optometrist or an ophthalmologist. And if you want to see that video, it is in the card above or in the description below. And if you don't even know what an optometrist or an ophthalmologist is, well, I got that video down below also. But in this video, I want to answer the common questions that I normally get from people who have never gotten their eyes checked or who rarely get their eyes checked.
Why should I spend money at an eye doctor when my eyes are perfectly fine and I don't have trouble seeing?
So to answer this question, I'm going to show you a picture of the back of the eye. Now don't worry, if you are a queasy type of person, don't like to see pictures of the body, this is just a drawing, so it's okay, we can make it. But if you want to see me describe what it looks like in the back of the eye using a little green screen effect, then push this card above and it'll take you to that link. All right, so this is what the back of the eye looks like. Hopefully you're okay with that and nobody gets too queasy about the drawing. But what we're looking at is maybe about 30 to 40% of the whole back of the eye. So what do we have here? We have blood vessels, we have this circle over here and a dot, okay? Done. No, I'm just kidding. So we have the blood vessels and these are what feed the eyes. And right in this area is where all the blood vessels enter and exit the eye. This is also called the optic nerve or the start of the optic nerve because also all the nerves in the eye funnels out of the eye to go to the brain from here. All right, what this dot represents is the center vision. This is the only thing in the whole eye that we use to read right there, okay? You have all this area, even stuff that you can't see on this drawing, all for side vision. That's our peripheral vision. And this little guy for our reading. Now we have some area around this that we call the macula that helps us see that center vision. But this spot here called the fovea is what we actually use to see the clearest vision or the smallest letters. Now, the reason why I like to show this is because when someone tells me, I see pretty good, doc, I don't need to see the eye doctor, I tell them, great, 2% of your whole eye is healthy. Everything else, honestly, we don't know until we look. Because you have over 1 million nerves in each eye and their only job is to see light, not to feel. Okay, so if I had a problem way out there, I'd still see 20/20. Okay, the brain could just ignore what's going on over there. Why? Because we can't feel it. Okay, it takes a lot of damage for us to realize that we're having issues in that peripheral vision, but if it ever hits that reading, it's really hard to get it back. Okay, so that's why we look. We try to find the small problems before it becomes a big problem. So what else do we do in an eye exam other than just look at your vision? We can also look at how your eyes work together and how they move together, which will affect depth perception and balance, but also how the environment affects your eyes, like allergies and dryness. How does your eye feel at the end of the day, and how does your eye feel at the end of the week?
Will I have to wear glasses just because you can make my vision better?
All right, I love this question because remember, glasses are a tool to get the job done. So if I can move a stool or a chair with my bare hands and my own muscles and move it from this side of the room to that side of the room without a dolly, great, do it. Would it be easier with the dolly? Maybe, but if I don't need it, I'm not gonna use it. Now, if I had a 300-pound chair to move from one side to the other, me just using my own muscles, eventually, I'll just hurt myself. So I'm gonna use that dolly to help me get from point A to point B. So in the exam room, I can make almost anybody see better using my machines to help them see clearer. Now, that doesn't always mean it's gonna improve their quality of life. So I only prescribe glasses if both the patient and I are in full agreement that it will improve their vision in daily life.
Can't you just renew my prescription?
So this question is for those who already have a prescription. So they already wear glasses or contacts and they just want to get a renewal. They say my vision is the same. Why would I need to get my eyes checked if you can just give me a new prescription and I can buy my glasses whenever, wherever I want? Legally, no. I cannot renew an expired prescription without completing a comprehensive eye exam first. Remember, I'm not looking at your glasses or your contacts when you come in for your exam. Yes, we can make some tweaks and adjustments or clean your glasses if you need us to. What I'm looking at are the effects that the glasses and contacts have on your eyes. I'll often see a myopic or nearsighted patient's prescription decrease over time, or a hyperopic or a farsighted patient, their prescription will sometimes increase over time. These are subtle changes and you won't always notice those changes, but if we don't make those adjustments to your prescription, you can often find yourself with eye strain and headaches. And contact lenses in particular can cause issues with the health of the surface of your eye if not cleaned, worn, or replaced correctly. So my question for you is, how old were you when you had your first eye exam? Now, if you say in the comments below never, then I'm gonna call your local eye doctor and tell them to come get you. So if you like this video, please give it a thumbs up, give it a like, and subscribe if you haven't already so you don't miss other videos like this. And don't forget to hit that little bell icon so you get notified when we post another video. If you found value in this video, then please share it with someone that you feel like may benefit from this topic as well. Remember to keep your eyes clean and clear so you can stay focused on what truly matters to you in your life. I'll see you guys next week.